Dr. Laurent Guétillon. I'm a professor of large animal medicine here in the College of Veterinary Medicine. There are two main types of diseases we are focusing on. One that's really a chronic disease of the respiratory system in young horses, more young athletic horses. And then the second one is a disease that's more clinically observed by horse owners, and it's known as heaves. So what we've developed is a test using the high-speed treadmill. What we do is we have a test whereby every minute we increase the speed up until the horse reaches its limit. And then at the same time we have a catheter in a small artery in the side of the face of the horse, so we can collect blood during exercise and check oxygen level in the blood and carbon dioxide level in the blood. And that way we can detect when there's abnormalities, especially when the horse starts really running. After that, the idea was to develop also another test that would allow us to assess the lung function.
What we were looking at specifically were horses with RAO, which is recurrent airway obstruction, and it's a very similar condition to that of asthma in people. So when they have the immunological response in the respiratory system, they get that real heavy breath, like a lot of constriction in the respiratory system, and it's just something that's really uncomfortable to horses. So this study, we actually took horses with that condition, put them in an environment that induced them to have the asthmatic attack while we of course monitored them to make sure that they stayed healthy and were okay, and then tried to treat them with a drug that was previously used in human medicine that was a bronchodilator to just kind of relax the respiratory system and allow them to either come through the asthmatic attack or to prevent it altogether without having to do a lot of management changes. You'll see that we did a pulmonary lung function test, which did include a tube that was passed through the nose into the lung and had kind of a little balloon on it. We were then able to hook it up to a machine that measures pressures of the horse's forced expiration and inhalation. So it's looking at how much effort goes into the horse's breathing. So then we did a BAL, which is a bronchoalveolar lavage, and we did ours blind, so meaning we didn't have a camera on the end of the tube to be able to really go in and assess the airway passages. So you just put fluid in, a desired amount, like 500 milliliters, and then you hope to get that back. Because then it had entered the lung and come back out, hopefully as sterile as possible so you don't have any contamination. And then you can be able to assess what antigens and things are present in the lung.
We also are already testing treatments. I mean, we have an idea of what's causing the disease. What we showed is that treatment with drugs help these horses with steroids and bronchodilators. However, being out there on pasture 24/7 is the ideal treatment.
The research that we specifically did, I think, can have a dramatic effect on owners because RAO is one of those conditions that people just kind of learn to live with. It's very similar to asthma, and that's essentially where I think the equine industry is with RAO. It's, okay, when my horse has RAO, we can't go do a lot of trotting or galloping. He can't have hay, he has to be on hay cubes, that type of thing. And I think if this study turns out the way we want to, and of course we hope it does, then this bronchodilator could change a lot of lives for horses. I mean, a lot of the horses that we use on our study were donated just specifically because they have RAO, and the owners couldn't change the management practices that they had because they were too expensive or too time consuming. So it would really allow horses to not only be a lot more comfortable in their breathing, but owners will know how to properly manage their horses and be able to use them for what they want to do.